A lot of fun stuff, but we've also got the one thing you should know when it comes to your medicine cabinet. Do you have the right essentials, or are you doing more harm than good? Stay tuned for that. So this is a question a lot of us ask. Is our medicine cabinet stocked well enough?
To keep your home as safe and the people in it as healthy as possible, there are some must-haves. Next, the items you should stock at all times, and the one thing you should have in your medicine cabinet right now.
Thank you, Nikki. Now we're focusing on our medicine cabinets. What's the one thing you need to have in yours? Having the right items on hand when you get sick can help you get started on the road to recovery more quickly. So we brought in this morning Dr. Dr.Vee from the Mayo Clinic to tell us about it. Good morning to you, Dr. Vee. Thanks for being here.
Hi, Stacy. Thanks for having me back.
You've got a number of products, but the one thing,
So,
the most important thing to have for the medicine cabinet is?
The one thing that you should have in the medicine cabinet actually isn't even in the medicine cabinet, but instead it's something you can add to the medicine cabinet, which is a lock.
A lock.
A lock.
That's shocking to hear because I think you'd say, you know, aspirin or something like that, but it's a lock. Why?
Well, every year, over 70,000 emergency room visits are a result of accidental overdoses of medications by children under the age of 18. And these include over-the-counter medicines like iron, acetaminophen, prescription medications that treat high blood pressure, depression, and of course, narcotic pain relievers.
Okay.
And unfortunately, prescription painkillers are the most commonly abused drugs among kids between the ages of 12 and 17. And parents are shocked to find out that the kids who are actually abusing these drugs say that it's super easy to get the medications, and they get it from their parents' medicine cabinets.
But if you get a lock on it, and if only you know where that key is, you could help avoid that. Okay, so we've got the most important thing, the one thing, but if you were to have a couple of other things that are important in your medicine cabinet, what would you pick?
Sure. Well, I think the important thing that you want to have inside your medicine cabinet is diphenhydramine, and that's just a long name for a medicine that very simply prevents allergic reactions. You never know when you're going to have an unexpected allergic reaction, either in yourself or in your child or a visitor who may be there. So this will help prevent that.
Time is of the essence if you have an allergic reaction because your airway can close and you could die.
Right, and you can use liquid or you can use the pills. And of course with liquid, for children, make sure that you check the dose with your pediatrician
Give the right dose. And what else would you keep in there?
So I think for adults, the most important thing is this, which is a baby aspirin or a low-dose aspirin. And this is to help prevent heart attack and stroke. Of course, you want to check with your doctor to see if it's safe for you to use this, especially if you have bleeding problems or if you have ulcers. And here's the most confusing fact. You should never give babies a baby aspirin, even though it has it in the name, because actually there's a very serious complication that can occur in some children.
All right, so we've got some ideas now on what you need to have in your medicine cabinet. Thank you so much for being with us, Dr. Vee.
Thank you for having me, Stacey.